Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health podcast. Good afternoon, everyone. Good afternoon to everyone. So, today we will be discussing about breast cancer. So, as you may know already, breast cancer is the most common breast cancer among women. Of course, there are also breast cancer among men, but that's very, very few, about I'd say 1 in 200. So even men do have breast cancer. So today I would like to discuss about breast cancer because we do get a lot of patients who are in their late stages of breast cancer, which is sometimes when they come see us, medyo they are already in their late stage. Malalaki na yung bukol. Some of them nabubulok na, mabaho. So, usually pag ganito, when you have those kinds of cancer talaga, it's really hard to treat them. So, I would really advocate, if you notice may parang lump, may parang breast mass, please don't take it for granted. Huwag niyong pababayaan, huwag niyong isipin, ay, mawawala yan. No? So, always think about, if you don't treat it now, or if you don't look after it, it might go to become more severe and harder to treat. Marami na ako nakita na who are nagsisisi sa huli because they were not able to treat it earlier. So I would really suggest, if let's say may nakapa kayong mass, the easiest thing to do right away is go see your doctor, do an ultrasound. Okay, I don't really advocate mammogram. I would suggest instead of mammogram, just do MRI, kasi minsan sa mammogram, aside from being very, very painful, minsan because of the radiation, medyo hindi maganda. Especially for young women doing yearly mammograms, they found out that you might even have a higher risk of breast cancer just because you've been doing mammogram on a very regular basis. So I would really suggest instead of a mammogram, just do an MRI. So that will be clear, and less trauma on the breast, and of course less painful for the patient. So I'd really advocate and encourage everyone to do your breast exams at least once a month right after your period. Now for those women who are postmenopausal, if you develop a lump, okay, postmenopausal, most likely that lump is not benign. Okay, so let's say wala ka ng mens and then suddenly may nakapa ka. Okay, huwag mo na isipin na baka wala yan. There's something, okay, it most likely is not a good type of tumor. So I would suggest you see your doctor immediately. Now, for those who have breast cancer, okay, the always question I get is, if let's say you have a tumor, they have it removed, are you supposed to do chemotherapy, radiotherapy? Well, of course, I will always tell the patient, it is your choice if you want to do chemo or not. Okay? So eventually, it is going to be your decision. Okay? Now, as to doing complementary therapies or integrative therapies, again, it's a choice. You make the decision together with your family. Kasi it's sometimes maraming they will not do chemotherapy, their surgery or radiotherapy, then they go full alternative, and then because it's not working, or all the suggestions or the treatments were given were not so good, so sad na they come see you, the cancer is all over the body na, so what can I do, or what can doctors do if that happens? So it's really hard. So if you do develop, or if you have cancer, always make sure that the ones you're seeking advice really knows what they're doing, and don't believe in one drug or one medicine or one supplement will cure you or gagamutin ka. There's no such thing as a magic bullet nga naman sa cancer. If there is, then wala na tayong problema sa cancer. So always consider that when you have cancer, you have to think about all the aspects, or kumbaga yung pinaka situation mo with regards to your physical, emotional, psychological, as well as your financial situation, no? So I also see a lot of patients who spent, all their money doing all the stuff that is not even recommended, and then one day they come see you, wala na pala silang pera, naubos na. So these are things that we want to avoid, no? We want to make sure that you get the right treatment at the right time. Okay, so we should not be kumbaga, very one single-minded approach na, oh, this is the only solution, or this is the only way, or this is the only person who can treat me, no? So we have to be open to other suggestions, we have to be open to other recommendations. Huwag tayo basta maniniwala agad, no? Kasi sometimes with just surgery, no? Surgery, when you do, especially breast cancer, when you do surgery, the risk of recurrence or metastasis, you already cut it to around 60 to 70%. Okay? Surgery alone. So, if surgery is needed, then go for it. However, if surgery is not an option, then you consider other alternatives. Okay? Whether it's chemotherapy or radiotherapy, or all those other complementary therapies or integrative therapies like IV vitamin C, high-dose vitamin D, B17, that's also an option. You can also have mistletoe, no? In fact, in Europe, no, they use a lot of mistletoe. So in Europe, they were giving mistletoe to hundreds of thousands of women, no, with breast cancer. They showed that mistletoe actually improved their quality of life, besides having a longer survival, no? Aside from that, of course, high-dose vitamin C is a very good way of, boosting the immune system, as well as its ability to really fight the cancer, no? Of course, if a big tumor, don't expect na lumiit yung tumor in 1 to 2 injections. So these treatments takes time. It's not, wala namang treatment na after 1 to 2 months completely healed ka na. There's no such thing, okay? So you have to understand this point, no? So make sure that when you're going to do a treatment, you always research. Don't believe in what they tell you. Always do your research. Make sure that what they are saying is actually based on facts or based on studies rather than based on their opinion. Okay? So of course there will be treatments that are a bit strange, no, or wala talagang actual studies. But if you are recommended a certain treatment na you're not comfortable, then you ask them, maybe we can try something else that I would feel comfortable, or I feel that is more effective for you, no? Note that for patients if you have breast cancer, you might also have issues with your, hormones. A lot of patients with breast cancer, especially after they did their chemotherapy, they start, losing or having menopause, no? So it happens, especially if they do chemotherapy. This happens, no? It's because the chemotherapy or your cancer is hormone sensitive, so they will give you medicine para stop yung production ng hormone to stop the growth of cancer. So that's very common, especially if you have breast or ovarian type of cancer. Okay, so a lot of women also with breast cancer have problems with their thyroid, no? Especially if their iodine levels are very low, no? So patients who are very low in iodine usually develops cysts, not only in the breast, they will also develop cysts or tumors in their thyroid, as well as cysts in the ovary. So this is very, very common, no? So this is not, this is not a very uncommon. In fact, very, very common yan. So pag may breast cyst ka, when you do check for your thyroid, some of them have thyroid nodules, tawag natin. So that's because they have lack of iodine. So aside from the lack of iodine in patients with cancer, no, not just breast, in cancer, no, they would have problems with iodine absorption. Maybe because they're not eating enough seafoods, or they're exposed to other halogens, no? Iodine, aside from iodine kasi, other halogens can block the absorption of iodine, such as fluoride, no? So where do you get fluoride? Usually yung toothpaste, no, have high amounts of fluoride. So that can block your iodine from being absorbed. Okay, other than that, fluoride, you also have the bromide, no? So bromide naman, usually sa mga bread, usually they put bromates in bread. So you would see sometimes, no, may mga bread when you go bromate free, no? Because some breads they put bromates, no? So we avoid also bromates, no? As well as those, so you have bromide, you have fluoride, and the other one is chloride. Okay? So aside from the chloride that you know from salt, which is sodium chloride, there are other chloride forms, okay, like tawag natin yung sunrox, no? So that's hydrochlorous acid, no? So they do contain a bit of hypochlorous acid, which is, you don't want to be exposed, lalo na ngayon during this time of COVID, no? When you inhale them, it's very, very toxic. So we have to be careful not to inhale yung mga chloride or chlorine-based disinfectants. Okay? So make sure when you use disinfectants, use the less toxic ones. So the less toxic one would be hydrogen peroxide, no, versus hypochlorous acid. Also, we do get a lot of patients, whether it's breast cancer or colon cancer, those who patients, they always have issues with regards to what to eat, no? So, but of course, in general, no, for patients with cancer, we really have to avoid eating meat, no, because meat is tawag natin inflammatory, so they can cause inflammation, pamamaga. So we do have to avoid these types of food because they cause inflammation and they actually put more stress on the body, no? So of course, if you're a cancer patient, your body's already stressed. So if you eat a lot of meat, that puts, additional stress on your body. So instead of eating meat, eat more fish. No, not seafood, more fish, like sardines, mackerels. If you like tuna, no, make sure that they are not from cans. Okay, so get it from the sea, fresh ones. No, avoid ones from the in cans. So you can get them in bottles, like bottled sardines, and that's pretty fine. That's pretty high also in omega-3, no? So aside from omega-3, from fishes, you can also take in, especially women, no, flaxseed oil. Okay? So women who have hormone-sensitive breast cancer, yung mga may estrogen and progesterone positive cancer, flaxseed oil is a very good additional supplement or armament against hormone-sensitive breast cancer. So what's the best way to take in flaxseed oil? Normally, when you do buy flaxseed oil, they come already in capsules or in liquid bottles. But, the storage cannot be in a very high temperature, no? So another way is you get flaxseed seeds, and then you ground the seeds, and then grounded flaxseed, then you can mix it with your drink, or you can put it in your salad or whatever. So at least it's fresh, no? Kasi sometimes when you get it in capsules, usually they turn rancid, no, or sira na because of the temperature, no? But there are health shops where you can get refrigerated flaxseed oil, no? Then that's fine. That's the ideal preparation and handling of flaxseed oil. So aside from omega-3, flaxseed oil, other sources of good fats would be your avocado, no? So avocado, just don't mix avocado with milk, okay? Because then you negate the effect of the avocado. We want avocado because of its high in omega-3 content also, or aside from that, good fats. How about virgin coconut oil? You can take virgin coconut oil, but do not take too much. No? What is too much? I'd say if you take more than 3 tablespoons, it might be too much already. Okay? Unless you're losing weight, you need to add more weight, then you add in more coconut oil. However, if you're healthy naman, your weight is stable, you're not losing weight, or you are gaining weight, then 1 to 2 tablespoons of coconut oil is enough. Why? Because coconut oil can increase your cholesterol as well as your total cholesterol, as well as your LDL or the bad cholesterol. We call them bad, no? Because if you have high LDL, then you're more likely to develop heart attacks or stroke. So for virgin coconut oil, no, we have to make sure maybe just take 1 to 2 tablespoons is enough already. Like if you take too much, then you'll start having problems in your cholesterol levels. Okay, so aside from your omega-3 flaxseed oil, your virgin coconut oil, your flaxseed oil, you can also take other oils. Would be vitamin A and vitamin E. Okay, so these are also what we call fat-based vitamins, no? So it's also good to take some vitamin A and vitamin E. So you can get this from nuts, from seeds. Okay, you don't really need to take supplements if you don't want them. So you take a lot of seeds and nuts. Take your vitamin A, your carotenes from your orange purple vegetables. Okay, so they have high amounts of carotenoids. Okay, now the last vitamin that I really suggest for all types of cancer, okay, especially in these times of COVID, okay, so we want to give you high doses of vitamin D. So at least take 5 to 10,000 units of vitamin D a day, okay, because vitamin D not only helps in preventing or preventing as well as making your immune system stronger, okay, they can also increase your lifespan, especially for breast cancer, no? So they found out that patients with cancer, okay, whether it's breast, colon, if their vitamin D levels are low, you're more likely to die from that cancer. However, if your vitamin D levels are above normal, around 60 to 80 nanograms, then your chances of survival are actually increases, no? Similarly, that is also what we see now in patients who develop severe COVID infections. So they found out that patients with severe COVID infections have very, very low or very, very deficient vitamin D levels. Okay, so those who develop very severe COVID or those requiring ICU already have vitamin D levels of less than 20. Okay, so your normal vitamin D should be around 30. So if your vitamin D level is less than 20, you're more likely to develop severe COVID infections that may even require ICU. So I would really, really suggest everybody to take vitamin D if you're really afraid of contacting the COVID infection. Okay, so one thing that I do notice, especially in Filipinos, is we rarely talk about, or the family doesn't really want to talk about the diagnosis of cancer. I think that's one issue that is very, very Asian. This is not only a Filipino trait, this is like an Asian trait. If one family member has cancer, it's like a curse or bad luck. It's not so it's supposed to be discussed, in outside the family. But I think we should be able to discuss freely, and talk about, because sometimes even among family members, they don't even want to talk about their own family, loved ones who are diagnosed with cancer, and this creates stress on the patients themselves, not only on the family but on the patient. Sometimes they feel ashamed that why did I have cancer, and then it becomes worse. So I think we have to make sure that when one of our family members develop cancer, that we have to tell them it's okay, it's nothing to be ashamed of, right? There's nothing wrong. You did not, you might have, let's say, not taken care of your body, or you were exposed to a lot of toxins. It's not entirely our fault, right? So we have to make sure that when we are diagnosed, or when our loved ones are diagnosed with cancer, that we have to give them a emotional as well as a psychological support, okay, because they really need it, whether they show it to you or not, but they do, because once you're diagnosed with cancer, they feel like they're alone and no one really understands them, or they go into a state of denial. They then, especially in the early stages of their diagnosis, they go into denial. They will not admit that they truly are a cancer patient. So we have to give proper support to our loved ones, especially if they have been diagnosed with cancer. Okay, and lastly, the last topic on cancer is really the financial. I call this financial toxicity, because when you're diagnosed with cancer, of course, you'll be spending a lot of money, trying just to treat the cancer. So I think this is one issue that we really have to consider. Okay, so if you need to, to make sure that you have enough money, not just to survive, okay, not just to get your treatments, but also money for your whole family, because sometimes we do get patients who spend all their money on treatments, and then you hear they don't have money to buy food for the next few weeks. So that's sad to hear. So when we do our diagnosis with cancer, we have to also do some computations, make sure that we don't spend all the money on just trying to treat the cancer, because then the stress of getting more money or trying to live the next day because you don't have money in the wallet creates more stress on not only on the patients but on the family as well. So I think this is rarely discussed or talked about, especially in the family, because oh, we will give you the best, we will make sure that you get the treatments that you need. But of course, in reality, if if your budget doesn't allow it, you have to tell your doctor, oh doc, this is my budget. So, and then let the doctor do some adjustments for you, rather than trying to say yes to everything, and then at the end of the day, you can't even afford to buy food to put on the table. So we have to be frank and candid with our family members as well as with your doctors, that this is my budget, so how can you help me? So I'm sure your doctor or your primary care would be Now I will read some questions from our listeners and answer them in this segment. More than willing to help you and see through that you will get able to get the necessary treatments that you truly need. Okay, so thank you everyone for listening. I'll see you again next week. Next week we'll pick a topic based on a poll which we will be coming out, I think, tonight. So you choose which topic you want us to discuss next Tuesday again. So thank you. I'll see you again next week, same time at 4:30. There were some questions that we weren't able to answer, no? So I think I'll answer them. Okay, I think we answered the questions about breast mass after menopause. So if you're menopausal, please make sure you see your doctor immediately. Okay, so if you're so some Joseph asking if you have substitute for meat diet. Of course, you avoid meat, you take in fish and lots of vegetables, avoid white rice, white bread, and all those, everything that is sweet. Okay, so if they have allergies to seafood daw, they said allergies to seafood, what's the substitute for meat? So you can still get protein from mga nuts, beans, diba? Mga mongo. Those are beans that are high in protein. Okay, so it doesn't have to be just meat. Okay, it's not correct to say that only meat would give you protein. Actually, that's wrong. Somebody's asking if you have dry skin from chemo, what lotion can you use? Actually, I don't suggest lotion. I would suggest you apply some aloe vera. Okay, aloe vera is a very mild moisturizer. Okay, or if you have essential oil, there are ointment made from homeopathic preparations of calendula. That's a very drying skin. Thank you again, everybody. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesispodcast.com. Thank you again, and please do come back for our next episodes.